Hi, my name is Dr. Niemann. Just want to talk a little bit about total ankle implants. In the Valley, there's quite a few of us that do total ankle implants, but very few of us have done them for quite some time. I've been doing ankle replacements for about 15 years, and I trained with a surgeon who had been doing them quite frequently. As we've developed and understood total ankle replacements, we're seeing very good patient satisfaction, very good results, and good long-term outcomes. Patients who are dealing with post-traumatic arthritis and stage arthritis of the ankle can suffer from just a lot of pain, a lot of immobility, discomfort, and it does create a lot of limitations in their life. And so when patients come to me and discuss having their ankle replaced, it is a big deal. It's like, putting a new joint in your ankle. And so just like people get knee replacements and hip replacements, it's literally replacing the cartilage surfaces in your ankle joint. Most of the time we just replace the ankle. Sometimes we have to correct the posture and position of the foot. So when we put the ankle joint in, it's going to be stable and aligned. It's kind of like we can replace the engine in your car, but if the alignment or the wheels are not correct, the car's still going to go left and right. So sometimes there's some procedures that we do in addition to the ankle replacement. Most patients do have their ankle replaced in a hospital setting. It can be an outpatient or inpatient setting. Most patients are able to go home with a splint on, and the recovery really entails about 3 to 4 weeks of not walking on it, and 3 to 4 weeks of walking in a boot, and then about 2 months you're starting to do physical therapy. By 3 or 4 months, most patients are close to pain-free, still managing some swelling, but really end up living a very active lifestyle. To understand the possibilities for a total ankle replacement, I'd love to sit down with you and visit with you and give you some options. Of course, not every patient is a candidate for a replacement, but most patients, surprisingly enough, we can put an ankle in them. Sometimes obesity, sometimes diabetes, and sometimes other comorbidities can influence the recovery or influence the choice of implant or how we proceed with the procedure. But in the long run, most patients can undergo a total ankle replacement and really have good success and good recovery. You can catch some of our testimonials on our website of patients who have undergone replacements. And as you can see, they're very happy. They walk with a very normal gait, very pain-free, and almost wishing they had done it 10 years prior. So love to visit with you, love to meet with you to discuss potentially doing an ankle replacement. Again, the alternative is really a fusion, and some surgeons just want to fuse. Fusion is like the F word, we don't swear. In the long run, a fusion is basically taking the joint and sticking it together. And it's just not normal for your gait to deal with an ankle fusion. So definitely look at some options, including an ankle replacement. In the long run, I'd be happy to visit with you and discuss your options for a total ankle replacement.